Good afternoon, everyone. Thank you for coming to this afternoon's Health and Wellbeing Board. I know we've got a few colleagues online, but we're just having a look around the room to check that we will quorate, that we did have a health representative and council representatives and councillors to make sure that we're quorate for this meeting. We have to do the election of chair and vice chair this afternoon, so that's why we've got Councillor Dedman here with us to do the election of chair. Once we've done that bit, I will go around the room just to do introductions so that everybody knows who everyone else is in the room, but we'll just do our formalities first. So if I could ask our Democratic Services Officer to read out the housekeeping notice.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point at the War Memorial at the front of the building. Finally, please could everyone ensure that background noise is kept to a minimum and that mobile phones and other devices are turned off or switched to a silent setting for the duration of the meeting. This includes turning the volume down completely on laptops. Thank you.
Okay, thank you. So I'll do just on the main agenda items then. So just apologies to receive any apologies for absence.
I have apologies from Peter Browning, Bradley Stevens, Betty Butlin, Dawn Dawson and Siobhan Harrington. We have Betty Butlin being substituted by Tim Branson, Dawn Dawson by Ellie Lindlop, and Siobhan is being substituted by Lizzie Warrington.
Right. Thank you. I shall pass over to Councillor Dedman.
Thank you. Councillor Brown. Yes, I'm just doing this because the chair can't obviously do it. So and I'm the chairman of the council, and I want nominations from the table for the newly elected chairman. So do we have a nomination? Yes, councillor.
Yes, thank you. Could I propose Councillor David Brown as chair, please?
Do you have a seconder for that?
Yes, Chair, I'm quite happy to do that.
Okay, do we have any more nominations? Thank you then. Do you want to speak for your nomination or shall we just go straight ahead?
Well, I have spent a long time thinking what I could say to do, and I've got something written down here. It's been adequate for the last year, so I'm quite happy to propose him again.
Yes. I'm so sorry, Councillor Brown. I shouldn't have asked for that, should I?
Right. Thank you for those gushing
Yes.
nominations. You're too kind.
Yes.
Really. Yeah, it's not like I'm going to be the mayor of the borough for the next year, is it? So I think that's sufficient.
I'm going to leave the room now, so thank you very much. Thank you.
Sorry, Graham, you don't get to vote because there was no other nominations. I mean, we could have, unless somebody wants to have competing nominations. But okay, thank you all. So we'll move on to agenda item 4, the election of vice chair for the Health and Wellbeing Board for 25-26 municipal year. I'd like to nominate Patricia Miller, who's here online. So, and has been our vice chair for the last year, and said she's happy to sort of restand, subject to changes at the Integrated Care Board and NHS Dorset over the coming year. But for the time being, yeah, Patricia's happy to restand. Is anyone happy to second? Yep, Karen Loftus happy to second Patricia. Any other nominations? In the absence of any other nominations, Graham, I'm afraid you don't get to vote. It's just thank you, Patricia, for agreeing to step in as vice chair for the coming year.
Thank you.
Right, agenda item 5. Actually, before we go on to agenda item 5, confirmation of minutes, I will just do my quick run around the room just so that everybody knows who else is in the room. So I'm Councillor David Brown, the portfolio holder for Health and Wellbeing and chair of the Health and Wellbeing Board the last couple of years. We've got Claire as our Democratic Services Officer. Unfortunately, Louise is online. Louise Smith is our usual Democratic Support Officer, but she is online to help with the meeting as well. I'll go round, Richard.
Okay, I'm Councillor Richard Burton. I've got Cabinet Member for Children, Young People, Education and Skills.
Right, I'm Councillor Sandra Moore and I'm Cabinet Member for Communities and Partnerships.
Good afternoon, I'm Rob Carroll. I'm the Director of Public Health and Communities.
Hello, I'm Ellie Lindop, Deputy Director of Nursing Therapies and Quality for Dorset Healthcare, and here on behalf of Dawn Dawson.
Councillor Kieran Wilson, Portfolio Holder for Housing and Regulatory Services.
Good afternoon, Glyn Barton, Chief Operations Officer for BCP Council.
Hello, I'm Lizzie Warrington, Integrated Care Programme Manager at University Hospitals Dorset, and as was mentioned earlier, I'm here for Siobhan Harrington.
Good afternoon, Mark Harris, Deputy Director of Place for NHS Dorset.
Good afternoon, everyone. Cathy Hadley, Corporate Director for Children's Services.
Good afternoon, everyone. I'm Karen Loftus. I'm the Chief Executive at Community Action Network. We're the local infrastructure charity. With Chair's permission, I have been given an extra minute because before we start the meeting, particularly being that this is a health and wellbeing board, I just wanted to very quickly share with you a very small snippet of lived experience of mental health and wellbeing. So at the moment, I am having treatment for cancer and I'm quite unwell, and mentally it is taking quite a toll. So had a fantastic appointment with Occupational Health Dorset Healthcare, brilliant, and recommended that I went to Steps to Wellbeing, fantastic, great, booked myself in, had a chat with a chat bot, all worked fine, booked myself in, spoke to a fantastic chap called Matt at Steps to Wellbeing and had a 45-minute consultation. Again, quite intrusive, but okay, I was fine. At the end of the consultation, he said, you need counselling, Karen, to try and manage this quite difficult period of your life. And I'm like, great, 7 months to wait, 7 months. And what had happened is we had unpacked me. You know, my suitcase was unpacked. My stuff was strewn around. And now I have nowhere to put that stuff. I've been unpacked, but there's no one to help pack me up again. And he said, the only thing you can do is go privately, or sorry, goodbye. And that was it. And I said to him, how does that, you know, I'm like, how does that make you feel, Matt? And he's like, terribly depressed, terribly low. We're all really sad here because I can't help people like you. And I said, well, I'm going to the Health and Wellbeing Board on Monday. Would you mind if I shared this? And he said, no, I'd like you to share this. I'd like you to share it because it's really hard for those practitioners to have to say to people like me who are really struggling, no, we can't help you for 7 months. And I know we're in a difficult situation financially as a country. Of course we are. But I thought I need to share with you because, you know, we look at stats, we look at things, but here I am as a person. I've been unpacked and there's no one to pack me up again. So I wanted to share that because we really do need to maybe manage expectation, you know, because frankly, I wouldn't have unpacked myself had I known that I was going to have to wait for 7 months, frankly. I wouldn't have brought all of that out. So I think, you know, I just wanted to raise that as something that we really do as a system, or how I can be supported while I wait. You know, is there any other local charities that could have supported? None of that was brought to me. So I just wanted to bring that up. Thank you, Chair, for your indulgence. Thank you, everyone.
No, thank you for that, Karen. I think it is sorry to hear all that, and I think it is something important to keep us real, to keep us grounded and actually understand. Because I know we, like you say, we look at statistics, we look at flow diagrams, we have discussions about how the system's working and where pressures are and that sort of thing. But at the end of the day, it is individuals, you know, the experience of our sort of health and care services, isn't it? So, thank you for that.
Afternoon, Zena Dighton, Interim Director of Commission and Adult Social Care.
Hi everyone, I'm Scott Sappin, the Better Care Fund Manager for BCP Council.
Afternoon everybody, my name's Tim Branson. I'm Adult Social Care Transformation Programme Lead deputising for Betty Butlin today.
Afternoon, everybody. Graham Farron, Chief Executive of BCP Council.
Thank you all. And online, just if we could just have introductions online. So, Patricia, do you want to go first?
Yeah, hello everyone. My name is Patricia Miller. I'm the Chief Exec of NHS Dorset Integrated Care Board.
And David?
Hi everybody, David Freeman, Deputy Chief Exec of the Integrated Care Board. Thank you.
Louise?
Hi, I'm Louise Bay. I'm the manager at Healthwatch Dorset.
And Kat?
Good afternoon, everybody. Kat McMillan, Head of Communities, Partnerships and Community Safety at BCP Council.
And Louise, you can introduce yourself as well.
Hi, I'm Louise Smith, Democratic Support Officer for the Health and Wellbeing Board.
Thank you all. I think it's important. I think most meetings we do that because we often have substitutes and changes and different people coming and going from different roles. So just so that we know who everybody else is in the room and who's representing which organisation. So thank you for that. Yeah, agenda item 5, the confirmation of minutes, which have been circulated. Our last meeting, which was held on the 24th of March, 2025. I've had a quick look through. I know I usually have a first check just to check who's listed as present to make sure that that's all okay. But any questions or queries on any of the content of the last, or the decisions made at the last Health and Wellbeing Board? Does everybody look content that we approve those? Okay, great. Thank you very much. Will sign a copy of those as a correct record of that last meeting. Right. Agenda item 6 now, declarations of interest. Does anybody have any either personal or prejudicial interest to declare for the meeting? No. If there is anything that crops up during the discussions, then please feel free to raise your hand and let us know. Okay, public issues. So any public questions or statements? Have we had any?
No public issues.
No public questions or statements. Okay, thank you very much. So on to the main items of business. You'll see we've got a few main items of business, starting with the Children and Young People's Partnership Plan. But I did, I've taken the chair's prerogative. Well, I sort of assumed I was going to still be chair and took chair's prerogative to ask, after some conversations over the last week or so, for a quick verbal update really before we go into the substantive items regarding the Integrated Care Board plan, an update on the proposed changes, because I know quite a few people, there's a lot of stuff going on with our Integrated Care Board and it's moving quite rapidly. I know there's been requests about scrutinising changes and keeping informed and updated about where things are at. I think, David, online, you were going to give us an update so that the Health and Wellbeing Board are aware of where we are with the Integrated Care Board and the changes that are coming down from national government.
Yeah, thank you, Chair. I'm very happy to do that. Now, I have some slides I wanted to share. Can I just check how much time I might have for this this bit?
I think we're probably okay for 10 or 15 minutes. Yeah, we should.
Oh, okay. I can rattle through what I have. So just bear with me a second, and I'll get these. Okay, hopefully, colleagues, you can see the slides now. So there are a number of slides in. I'm going to rattle through them because there's a couple of key points to land on, but I'll give you the shape of this thing as it's been happening. First thing to say is that it has been moving at an incredible pace, as David has just said. So it's kind of pulling all this information together to give you a sense of what's going on, and at the end there's a timelines thing which will give you what's due to come as well. Apologies also to some colleagues in the room who have already seen versions of these slides 3 times in about a week and a half. Normally when you say you see these slides before, it's over the course of the month. It's rare that it's with about 10 working days, so apologies, but it's the nature of how this information is unfolding and coming together for colleagues, and obviously it grounds quite a lot of the discussions we need to have, certainly in terms of health commissioning and the role of the ICB and colleagues here in the room today. The first thing to say is that it is a big change that's coming. This is the King's Fund reporting on it. They talk about a seismic shift in the setup of the health system, a complete overhaul of the function and purpose of integrated care boards, accompanied by 50% cuts in running costs by October this year. In fact, that moved to December. But I think it's a really nice way of framing the size of the challenge. And this was an article in The Guardian that talks about those 50% cuts in job numbers. This is across the country, but you can see the scale of it. 30,000 jobs could go across the ICBs and more if you add in NHS England changes as well. And also, we've had a document published to supporters, the ICBs, that is, in sort of working out what those changes might mean. As a blueprint was published in May. And this is that. So the announcements for these changes were started in the starting gun was fired in March, but it took a few weeks for real guidance to start to emerge about what those future ICBs should look like. And this is the document that set it out. And it really sort of boils down to these sort of key things, really. You can see, if you look closely, I appreciate you might be far away from some of the detail in this particular slide, but you can see that of the functions that we're currently responsible for, 18 of those will transfer out to either a national or regional team and local providers. And I've underlined a few here. So you can see the sort of scale and nature of those changes, primary care, neighbourhoods, continuing care, safeguarding. I mean, all parts of the work that we're currently engaged with in local systems will be impacted by these changes. And of the rest, 6 stay and are retained and adapted, so they kind of run at a kind of scale level. And then the core ones are these kind of around this here, which are become the core functions of the new NHS organisation. And you can see from that split, roughly half of the functions change dramatically, which is what's kind of driving the change in the running costs as well. And the real focus in this new model that's coming, this new way of working, is about strategy and strategic commissioning. And I'm not going to dwell on this, but you can see, if you could leap your eye around these graphics that are coming in, the key words: population, data intelligence, forecasting, strategic options for testing, productivity, strategic purchasing, evaluating outcomes, value-based resource. You can see the shift in language and tone and the emphasis around what we now need to be focusing on. And there's also some work you can see from these parts here about these are enablers and capabilities that we are anticipating are required. It's about what we do now, but to another level, and also moving some of the functions out into other places as well. So it is not only a change in terms of scale of running cost allocations or running cost reductions we need to do, but in terms of the emphasis and how we take a view of the role we play across systems. I again shan't dwell on these things, but this is the Confederation who produced a document about what we mean by strategic commissioning, the model that's hopefully informing policy. And they talk about the changes that we need to make from the current broadly ways we work now, reactive, transactional, all the rest of it, to being much more strategic, and a redefining of the commissioning model, the commissioning cycle. I know this exists in local authorities and lots of other, either formally or informally, lots of the other organisations we are all involved in. There's a way of running our business and a way of doing things on a kind of annual cycle. The big things here to note is a huge emphasis on outcomes, on population health, and planning pathway changes and facilitating conversations with stakeholders and all the rest of it. It's so much further away, or a step away, from managing contracts on a kind of activity-based level way of working, which is what we do currently. I'm not going to dwell on this, but I was really touched by what Karen had said. And I'm sorry to hear your news, Karen, and do try and stay strong in all that's coming at you and around you. But it did remind me of this slide, which I knew obviously was coming up, that actually, if we don't do the right things and change and take a broader view of the factors that define people's health and well-being and hope and optimism for the future, then actually we're not helping. And this is plumb centre, isn't it, of the Health and Wellbeing Board work, that Marmot, who talks about the wider determinants of health, says that if health has stopped improving, it's a sign that society has stopped improving. and actually that we do a lot of work treating people, but then sending them back to the conditions that made them sick in the first place. We're not taking a holistic view of individuals, and we need to do more to strengthen that. These are the slides I'm not going to dwell on, given the time constraint we've got, just to sort of not make a nod to why it's sort of unravelled across health services. Tim Harford has this saying that when a measure becomes a target, it ceases to be a good measure. And over the years, because we've had targets in hospitals, mostly around 4-hour A&E, it's a good measure, because if you get seen within A&E within 4 hours, that's a sign that the hospital's running smoothly, and it's a great patient experience. You get your conditions sorted, treated, whatever you've done. But when it becomes a target, it attracts more and more funding. And we all know that if we had different interventions at primary or community or public health level, we would reduce the demand in ED in the first place. But this is what drives the change, and you can see the funding shift over time into the wrong places. We know where it needs to be. And there are models throughout the world. I'm not going to dwell on this, but you can see in different places that the funding model is completely different. And in this example, in Israel, the spend per capita is one of the lowest in the world, and they have some of the best life expectancy in the world as well. So to help us get to the point of managing a different way of working and coping with the loss of funding for running these organisations, we've agreed that we ought to cluster as a precursor to merging our organisations. And the cluster that we've set out is with Bath and North East Somerset, Swindon and Wiltshire ICB, which is one single ICB, BSW for short, and with Somerset and Dorset. And the three of us are coming together to form a cluster to operate at a scale where we can deliver the new responsibilities or the new expectations on the reduced budget. And helpfully, it does overlap with the devolution conversations that have been going on across Dorset, Somerset and Wiltshire in recent weeks and months as well. I again shan't dwell on this because you probably know it pretty reasonably well anyway. I would say though that there is a Wikipedia page for the Heart of Wessex Combined Authority, which I thought was really interesting and helpful. So if you want to have a look a bit more about what's going on there, do that. But just to point out some of the functions that are coming with strategic health, with the combined authorities, the mayoral authorities that are coming down the line. The emphasis and the overlap with strategic and oversight and holistic and health and wellbeing is there. So we should be able to support each other in these new arrangements. With all of this, we know what we need to achieve with the Integrated Care Board changes that are coming. We still await the 10-year plan for health. There's been a huge consultation on that at the turn of the year. It's going to say that we need to do more to move out of hospitals into communities, better use of technology and prevention. But we know it will also talk about, or we expect it to talk about, changes to the provider landscape, the importance of neighbourhoods and place-based working, which is right at the heart again of what this Health and Wellbeing Board is about, and a focus on the health of the nation, the wider determinants of health. And publication of this is expected very soon. For the colleagues who heard this slide before, I've seen this slide before, it's changed. It was mid to late July, it's now early to mid-July, so it's not much change, but it is a change. Final slide. I thought you might be interested in, so okay, if this is moving at the pace it is, well, partly why, but also what's coming next. So we're now in a process of NHS England and the Department for Health scrutinising our cluster proposals. That you remember that with BSW, Somerset and ourselves. And we're expecting details and final pronouncements on that at the end of June, which will then allow us to start the process of senior appointments, which we expect to take place between July and October, which will begin and obviously include the new chair and the new chief exec of this cluster organisation. And that then should allow all of the team structures to be put in place. The really, really important thing, and the reason it's moving at the pace it is that we have been challenged and tasked with reducing our running cost in totality by the end of December 2025 in order to release funding savings into the system and into the Treasury over time. So we are moving at a breakneck speed, a breakneck pace in order to get these things done, which is why colleagues are hearing this in quick succession. And then for the remaining quarter of the year, it's an ongoing transition period, readying ourselves. And then the only sort of uncertain bit at the moment, though we think we know what's going to happen, these changes just are a bit more challenging to take place because some of the responsibilities we currently hold are in the 2022 Act, which established ICBs in the first place. In order to take those responsibilities away and put them somewhere else, the Act needs to be repealed or reshaped or reframed. So we don't expect that will happen in time for the 1st of April 2026. So we expect to be running for a further year as a shadow single ICB across the cluster geography we just mentioned, with a view to becoming fully merged as a single ICB across a broader geography on the 1st of April 2027. So those two things might change slightly, but broadly that's what we're working to. And in this year itself is the stuff above. Right, so that's all I was going to say on that. Hopefully that was sufficient and not too pacey, but obviously happy to take questions or comments.
Yep. Thank you, David. That was really informative, actually. Any questions or comments from anybody in the room? Graham, did you want to?
Thanks. It's just the timing for the devolution deal, which so this boundary is being tied into our devolution proposal. The only problem is government are not making any warm noises about a second round of devolution, and we weren't in the first round. So it's possible those boundaries change. So we've gone from a position where the devolution proposal was for local government with health sort of somewhere in the wake, to a position where health is now effectively leading the devolution discussion with local government waiting to see when government is going to take it forward. So, you know, my main worry, I guess, is that health goes forward on this footprint, and for some reason, the footprints for devolution change, and I don't quite know how we're going to deal with that. I assume we just take it one step at a time, and you know, this is on a much tighter timescale for financial savings, but it does cause worries about the coincidence of the boundary, which this is a very good step to try and work towards a boundary that we've agreed, but it's not a formal boundary yet. So I just flag that as a concern. I don't think there's anything we can do about it.
Yeah. Thanks for that, Graham. I'll go to Patricia online first. Thank you, Patricia, if you want to.
Thank you. So just a couple of things just to add to what David said. So around Graham's point around devolution, the original proposals around cluster some of them were not in line with devolution boundaries, and there was quite a lot of pushback from Angela Rayner's team on needing them to align. I think that even as we move and transition from cluster to merger, if there's a need to flex where we've got to, so that new ICB structures do align any amended devolution boundaries, there'll be a really strong push for that from government. The cluster proposals are being reviewed by the Secretary of State for Health and Social Care this week. The second point was around the fact that obviously you see what the number of job losses is nationally in the NHS. More locally, just in Dorset, we're probably going to be losing somewhere between 200 and 250 staff. That, coupled with our local authorities also reducing their headcount, is a really important thing for us to consider in terms of the context of our work around local jobs for local people, the government's task force around getting more people back to work, and the fact that in many parts of Dorset we are a low wage economy. And one of the things I've raised with the Department of Health is that actually this completely cuts across the government's agenda around economic growth and increase in household wealth. And if this volume of jobs were being lost nationally in any other industry, the government would be having an emergency committee to discuss what Plan B was going to look like. And yet there is a perception at the centre of government that we can just persuade people to leave the NHS and they will walk directly into another role, which is not the case in many areas where this is happening, because it's not geographically prioritised around the economy and the ability to re-employ. So my biggest concern is that we will have a high number of people entering the job market for which there will not be sufficient opportunities for them, and that could actually stifle growth in the Dorset area, and more importantly could put more pressure on our health and equality services, because people will not have sufficient household income to support their families.
Thank you for that sort of additional insight to it, Patricia. Yeah, Karen next, and then
I don't know what to say. I wanted to say something. I'm going to say breakneck speed, I think, David, is what you said. And it just seems so fast. And, you know, I guess I just wanted to send my thoughts because it can't be easy. You know, in the voluntary sector, I've had to make staff redundant very recently, and it's horrible. And it's very difficult to maintain the day-to-day job. You know, it's very difficult to focus when you have that going on as well. So I guess that's all I wanted to say, really. It can't be easy.
thanks for that. Kathy, did you want to?
Yes, thank you. In other forums, I've acknowledged the challenge, both professionally and personally, for everybody involved, and the speed at which it's happening, and the need to try and keep business as usual going, which would be an incredible challenge. There is, for me, some thoughts around whether government departments are working together, because obviously there are some pressures around. If I particularly think about children's, as we move forward, the capacity to deliver the legislatory requirements for safeguarding currently with the ICB going across both Dorset and BCP is a challenge as it is, which my health colleagues do set their stall out and manage. My concern will be is how that then gets managed under shadow form before legislation is changed, because that is an incredible amount of resource that's needed to cover all those local authorities. I know that has been raised within the professional departments for adults and children's social care about how things like that will be managed. And so there's an element of hopefully supporting some of those messages of capacity happening through the system. But I would also like to point out there are a number of reforms that are happening in different areas, especially around children's social care. And is there capacity or understanding the multi-agency responses to deliver those reforms, which are particularly set out as multi-agency reforms, not children's social care for local authority? And how can we help and support that message as well? And then just to say, all of this change, I don't perceive that there's been additional capacity for our health colleagues to manage this transformation. And so that, again, just wanted to acknowledge that.
Okay, thank you for that. Any other comments or Robert, did you want to?
Yeah,
and welcome Rob as our new Director of Public Health and Communities to your first Health and Wellbeing Board meeting.
Thank you, David. I think, you know, just again to recognise that pace of change and the personal and professional pressure that you and our colleagues in health are under at this time, and really to say from, as a community of directors of public health in the new cluster area, we are meeting now on a regular basis to think about how we can support the model ICB going forward around its population health capability. So there's just something about, for me, about recognising what capability we've got in the wider system, recognising the headcount reductions that will be on all of the ICBs going forward, and that commitment to working together to look at how we can support the population health aspects going forward. Thank you.
Thanks for that. Any other comments or points? I did want to raise one point which has been raised on emails in the last week or so, was about scrutiny of changes. I know, David, you sort of replied by email to sort of clarify things. I don't know if you could just briefly comment on that, about the sort of roles of local authority committees and Health and Wellbeing Board.
Yeah, so the rules are that if the changes are nationally required, they're not required to go through local scrutiny committees. So if it was our local proposals to do this because we wanted to make some kind of strategic adjustment, then we would expect full scrutiny of the proposals. But because they're part of a national policy direction, they don't need to go through that to be approved. But at the same time, of course, we want to keep partners and colleagues involved and informed, and we will be more than happy to go wherever people want to in order to hear the latest developments. So today was part of that, wasn't it, David, to give an outline of how things are evolving, but we would be happy to go to scrutiny committees and talk through the changes that are happening as well, to keep people informed and give them a chance to comment, albeit with a slightly different lens.
Okay, thanks for that, David. Oh, Patricia, if you wanted to quickly come on.
Yeah, once we've got approval from NHS England's central team for the cluster, we will then, as part of our routine governance process, be undertaking an equality impact assessment for sharing with the ICB board. So for colleagues that are members of the board, that will probably be available at one of the public board meetings in part 1 for discussion.
Great, thank you for that. And yeah, I hope members are happy that we sort of had that update at the start of the meeting, because I think it will impact on integrated care partnerships as well, which I know a number of us sit on as well, and also then the sort of, to an extent, the role and remit and the importance of health and wellbeing boards, I think, in sort of delivering over the next couple of years as this sort of rolls out and it becomes clear about the differing roles and different governance. So so yeah, I thought that was important that we actually had that update. So thank you very much for preparing that update for us and keeping us involved and in the loop to as far as we can. So thank you. Right, okay, we will move on to the main items of business. So yeah, the Children and Young People's Partnership Plan 2025 to 2030.
Okay, I'm ready. Please let me know what the main items of business are.
Sorry. Right. Yes, Kathy, you were going to present on
thank
this.
you.
Thank
I feel this is a piece of work which is following a good piece of work which is following some somber conversations. Just to say, this is the Children and Young People's Partnership Plan 2025-2030 to 2030. I apologise to colleagues that have already seen this. This plan was launched officially with partners at a presentation event. And this plan has been developed by all stakeholders, voluntary sector, key partners, but more importantly, the voice of children and young people within it. This plan sets out the vision for our children that has been agreed, and it sets out the 5 main priorities that children and young people would like us as a multi-agency and system leadership to deliver and to work against. The plan is written in a way that sets out achievements already. It sets out the voice of young people, how we've heard from them. And when you look at what it is that children and young people want, it's no more or less than you'd want for your own children, your grandchildren, or any child that you have anything to do with. And so they're not asking for the moon, they're asking for the things that we would all want them to have. And to be honest, if you look at it, it would be the kind of things that I would want and make sure that I would have. So I think it's a really good plan. We will be developing some key performance indicators from all of us against those 5 priorities. And the plan actually has also been scrutinised against everybody's strategic plans. So health, education, our plans, to make sure that we're looking at the things that we all need to deliver on. There is a website for this, and there is a link that I can get out to you all, but you also can use the logo. This is a collective piece of work. It is not just BCP Council's work. What we will be doing is that we will have a governance structure against which we will hold ourselves to account against this plan, and it will be chaired by Graham Farrant as the Chief Executive. That's all I was going to say.
Thanks very much for that, Kathy. That's a useful run through, and obviously we've had the plan circulated prior to the meeting, and I some colleagues have probably seen it in other contexts as well. Any comments from any members want to sort of? Richard?
I suppose I ought to say something about this, and although it is slightly deja vu, because of course I've seen this many times because it's been to lots of places. We took it through council only last week. It was last week, wasn't it? Seems longer ago than that now. Yeah. And there's been a lot of really positive comments about this. It's been children's services over in scrutiny as well. I was at the launch as a manager. Quite a few of you here were and heard young people. You know, the 5 main priorities are obvious, aren't they? And in fact, the whole plan actually is really, I find, really obvious, and I think that what makes it such a good plan. I know there's a lot of having a good plan is one thing, but referring to it is something else. So that is something which I think, you know, as a group of people, we need to do is make sure that we keep going back to this and having a look what the plan is. Yeah, it's everybody seen it. I think feels it's really good, and I say particularly the young people. And to be honest, you know, in my mind, is what young people think to this is the most important. Therefore, you know, they're happy with it. It's written in a way that it is understandable. I find it really nice and plain to read. There's also an easy read version, isn't there? Which you can look at if you so wish. So yes, but I say I've seen it so many times now, and it's changed a little bit each time I've seen it. Up until last week, it changed a little bit, which shows it has been built on.
Thank you, Sandra. Did you want to?
Yes, thank you, Chair. Yeah, well, I really like the way this plan's been presented. I think there's some really good use of great photos and pictures, but I think it's the simplicity of the presentation that actually makes it so powerful. The plan does exactly what it says on the tin. It provides good data, sets out priorities based on the data, and shows how partners can work together to deliver them. So I think a really good plan, and well done. Thank you.
Thank you, Rob.
Yeah, I think just to echo those comments, I think it's a really good plan, really positive to see how the plan has been co-produced with local children and young people. Clear focus on health and well-being in the plan, but also looking at the wider determinants of health in the plan. So I love the inclusion of actions around green spaces, housing, community safety, a sense of inclusion, as well as mental well-being. Really easy to understand, really value the simplicity of the plan, and look forward to working with colleagues to deliver it.
Okay, thank you. Any other comments or questions? Oh, thank you. Patricia, yeah, you wanted to come in.
Just to say, Kathy, yeah, I agree with everyone's comments. This is a really great plan, and the fact that it's been co-created with young people is fantastic. The question you asked earlier on around whether the centre understand what's required in terms of not just children's delivery, send and safeguarding, the whole remit of ICBs, there is not a great understanding at the centre. What I think will happen going forward is that there'll be a very thin strategic planning function around outcome-based commissioning at the cluster, and then we'll need to invest heavily in place to make sure that the right things happen in the right way. And this is a really good example of where when we really motor on with place structure and have a refreshed health and wellbeing board strategy, that the way that the ICB will need to contribute to this agenda is through the work that's done at place while we're developing the provider landscape.
Thanks, Patricia. Anyone else? I'll just briefly comment. Yeah, echo the other comments about the sort of simplicity and the clarity and the attractiveness to an extent of the actual plan. You know, it's actually quite engaging to sort of to look through the plan. I suppose my only question is, I think the points made about making sure we continue to refer to the plan, and you know, rather than it being a great piece of work, a nice plan, but then we move on and carry on with our day jobs, is actually that important bit about making sure we are referring to it, making sure it is sort of linked into our other sort of into our sort of day-to-day work, and any sort of future sort of ongoing and review to sort of keep touching back to what it says is my only sort of question, really. Okay. Right. There's no other comments. We can move straight on to agenda item 9. So thank you very much, Kathy, for presenting that, and thanks for all the work that went on into preparing that, and I know actually launching it. I think I saw a video on the BCP Facebook page with you in, so yeah. Right, agenda item 9, which is the Better Care Fund 2024-25 end of year report. I know we're used to our Better Care Fund reports at every meeting pretty much, isn't it? Our sort of quarterly reports. So this is for the end of 2024-25. So Scott, if you want to, is it Scott and as Emma as well? Is there an Emma? Or no, she's
Jenny. Yeah, Jenny Crawshaw from NHS.
Jenny's coming in. Yeah.
Okay.
Scott, thanks.
Hi everyone, thank you. So I'll be presenting the Better Care Fund end of year report today, and as already mentioned, we've got Jenny Crawshaw here just to help me with any questions that you may have at the end. So just to quickly go through the Better Care Fund, the end of year report spreadsheet that's provided with the report provides a comprehensive overview of how the Better Care Fund was used across Bournemouth, Christchurch and Poole over the last 12 months. We'll also have a look at the expenditure, capacity and demand data and how we have performed against the metrics set in our plans that were presented to the board last July. We'll also reflect on what we've learned and how that informs our approach for the coming year. In terms of the performance metrics, so we met our target for the avoidable hospital admissions metric. So this has performed well across the year. So this has been thanks to an increased use of the same day emergency care pathway and some of the community screens that we have to provide support. So that's before it leads to an escalation of a hospital admission. We also performed very well on the discharge to the usual place of residence. That saw a strong performance all throughout the year. So we've got system initiatives in place such as Home First that play a crucial role. That makes sure that discharging patients home is always the first choice, as well as having support from the equipment service, working to deliver equipment swiftly to not only allow patients to return home, but to avoid any further delays. However, we didn't meet target for hospitalizations linked to falls. So despite having high usage and services such as Lifeline and our community's falls prevention programs, an aging population and high frailty levels has contributed to a challenge of this metric. We will continue to prioritise early identification of those at risk of fall, along with the BCP Council prevention strategy that will be published later in 2025. Residential admissions were also higher than planned. This could be due to wider economic pressures that contribute to people struggling to fund their own care. The Better Care Fund contributes towards the BCP Council self-funding team to offer robust support for those that do need to pay for their own care, to make sure that their care needs are met and are sustainable. And we've continued to make strides in supporting people to remain independent through the Disabled Facilities Grant and our care technology offers. BCP Council's Fulfilled Lives programme also aims to shift focus away from legacy care such as long-term residential admissions and more towards short-term preventive support over the next few years. In terms of expenditure, all allocated income was fully spent in line with the 24-25 planning document. Notably, the Disabled Facilities Grant did receive an in-year uplift, which has enabled us to invest further to meet the increased demand for home adaptations and support. And onto the capacity and demand information. So demand for Pathway 1, reablement and rehabilitation at home has remained high throughout the year, with a notable peak during the winter. This surge has impacted the length of delays, which we're hoping in 2025 will be addressed by providing more reablement at home packages and as well as our future care programme, which will continue to seek alternative pathways of discharge. We also saw sustained high demand for community services, so CAN and urgent community response, which is great as those have helped with admissions as previously mentioned, and those services will continue into the next year. And I just wanted to highlight some of the outputs over the course of the year that the Better Care Fund has delivered. So you can see what our community equipment service has done. We've had over 150 housing adaptations installed. Nearly 7,000 carers are supported by BCP Carer Support, 300,000 hours of home care, 90,000 hours of rapid response out of hospital care, and nearly 2,000 people receiving reablement at home packages following hospital discharge. And then I just wanted to sort of point to a couple of stories of the use of the Better Care Fund over 2024 and 25. So the first one I've got here is a gentleman called Mr. Smith. who's been living alone over the last few years, and he also has a long-term condition, notably COPD. He's been having challenges living at home. He's had limited mobility, and he has a neighbour who gives him support. The neighbour actually recommended that he seek the Disabled Facilities Grant to see if he could have any further support. So he had an assessment from an occupational therapist who recommended that some ramps, a wet room and a stair lift be installed. After the works were finished and the technical officer came out to do the sign off of the work, Mr. Smith couldn't hold back his enthusiasm for his gratitude that it brought to him, stating, "I can't believe what a difference you have made for me, and I can now have a shower on my own without support." So I think that really does highlight the great work that the Disabled Facilities Grant offers to people around BCP. And then I just want to offer another story regarding our Lifeline service. So we've got Miss Patterson, who is in her early 80s. She lives with dementia, has memory loss, reduced mobility, and has been identified as a high risk of falls. Her son often provides her regular care, but her reliance on him was causing increased pressure on him. So to be able to still support her at home, the BCP Council Lifeline Service visited and decided to install a range of assisted technology to her, such as bed sensors, a fall detector, and devices to regulate the temperature and prevent flooding in the home. These small but impactful changes have helped Miss Patterson regain a sense of independence and well-being. Her family now feel more reassured as they receive the updates from Lifeline, offering them a peace of mind. And then I just want to wrap up into what things are going to be looking like going into 25-26. So the last Health and Wellbeing Board, we brought that to you. So just to reiterate what the metrics will be in for this period. So it's going to be emergency admissions to hospital for people aged over 65. The average length of discharge delay, so from the date that's been stated to the actual discharge. And then we're still continuing with the long-term admissions to residential care homes and nursing homes for people aged over 65. So BCP Council and NHS Dorset have started evaluating schemes to ensure that they are going to achieve the outcomes as set by that BCP policy framework. And we'll be working closely with the Future Care Programme, with progress so far going well, with the Transfer Care Hub being trialled in UHD hospital wards currently. Thank you.
Thank you, Scott. Yeah, I don't know if Jenny, if you had anything to add to that, or if you're just available if there were questions online.
Yeah, I can jump in with questions if that's okay. Thanks.
Okay. Right. Thank you very much for that presentation, Scott. Any questions or queries around the detail of what's within the Better Care Fund? I know that sort of documentation is very extensive. The number of schemes are. How many schemes has we got within the Better Care?
It's about 50.
About 50.
25, 26, but about 57 in 24, 25.
Right. Okay. Karen, yeah.
Say about our little community action network contribution to it. You know, for us, we've found working with university hospitals and working with adult social care, sometimes it's not always a huge change that needs to happen to help somebody to leave hospital safely. It doesn't always need a big clinical intervention. What we have found, and there's a new working group been set up about it, is that hoarding it's been a big thing. Whether it's clinically, you know, there's a whole range we found of hoarding, from, you know, you can't get in the front door to, you know, just, you know, you're just losing track of things, you know, and you know how that can really change people's lives. You know, just making those changes, helping them to come home to a clean and safe environment, and just making sure that they continue in that safe environment can make a huge difference. And I know my team have been based in hospitals and working really closely, not just about hoarding, but I just wanted to highlight that was something that really stood out for me. When you're older, it can all get a bit on top of you, and then hence you've got people falling over because they've got stacks of stuff everywhere. So I think, you know, it's a bit, one of our big successes, I think, has been helping people to get home safely in that environment. once they admit that they need the help, of course, because, you know, us older people, because I'm nearly in that age bracket, I'm going to quickly stop speaking now. Thank you.
Any other comments or questions for Scott or Jenny at all? Or are we going to let them get off lightly? Are we going to sort of
I just wanted to extend my thanks to CAN because I know the great work that they do. I know I get reports from you about what you've done in terms of helping with hoarding, because I know that can be a great obstacle for people being discharged. So I just wanted to extend my thanks for that.
You're welcome.
while I wait for anybody to think of any other comments or questions, I'm going to jump in as well. I think actually those sort of those examples, the real life examples, are quite insightful. I think, like Karen said earlier in the meeting, is actually trying to remember the individuals that are receiving these services at the end of the day. And certainly, I've seen a number of cases around disabled facilities grant. You know, the change that can make for people, and the amount of extra independence and you know, continuing to be at home without sort of having lots of care packages or considering residential care. So I think things like the disabled facilities grant is really important. And all the discharge bit, I know we had a case in the last couple of weeks, and actually had a question at full council last week regarding delays in somebody being discharged from hospital and moving to a community hospital. And I know when we looked into it a bit, it was a real hectic and busy time, I think, in the community hospitals, when there were quite a number of people waiting to be discharged, and there was a lot of pressure on that area. So I know the system wasn't perfect at the time, there were delays there, but I know that actions were taken to shift resources to particular areas, so that actually when it was referred to our sort of commissioned reablement services, they were able to set up and implement care package within a day of being notified, although there'd been a number of days sort of delay getting to that point. So and for me, that really highlighted, you know, the individuals at the end of the day, the importance of this, and I know that it's not just the Better Care Fund looking at that, but actually that's a whole lot of what the Future Care Programme is all about as well, is actually focusing on those areas and making sure the system is working adequately and effectively, that there aren't those unnecessary sort of delays at different parts of the system, and making sure the system works and flows as best as it can. And I suppose coming back to the presentation we had earlier about the changes with the Integrated Care Board, that and the mention we had earlier about keeping business as usual going while there's all these significant changes going on within the system. For me, my immediate concern, learning some of that, was about our Future Care Programme. You know, it's really critical that actually, I know that's moving at quite a pace, and there's a lot of groups working on that, and there's a lot of reliance being placed on that programme delivering for our acute hospitals, but also for our care system, and for people, you know, around admissions, but also around discharge from hospitals. So that's my concern, is that actually we have people, inevitably the focus has to be on other areas because of the Integrated Care Board changes, of actually being able to make sure, not just on the business, focusing on the business as usual, but focusing on those priority strategic projects that we've got going on that we really need to deliver to actually mean that the system will keep working into the future for all of our residents. So yeah, that's just my only comments. Anyone else wanted to? Rob, did you want to comment?
Yeah, I think just to pick up on the emergency hospital admissions because of a fall, and recognising that performance is not on track for that, and just an offer really, or a commitment to work with you to look into that in more detail, and to think about that in the context of the transformation programmes we've talked about, but also the prevention strategy that is currently being developed as well. So, you know, I know that's a local priority. It's also a priority for the Integrated Care Partnership as well, and I think we could do a piece of work together to better understand that and the services we've got in place, and whether we need to put more services in place to reduce falls.
Okay. Any final comments, Scott or Jenny? Anything you wanted to pick up on?
Yeah, I can comment on the falls bit if that's okay quickly. Thank you. That would be really good to look at that. I just want to highlight in terms of work that's going on at the moment to support falls as well. There's the development of our INTs, and there'll be a focus with INTs on prevention. Currently, within the Aging Well network, there is focus on identifying people who are at high risk of falls and putting in strength workshops for people. Admittedly, that is a little bit sporadic in terms of its delivery. So we hope that INTs can pick that up and have a focus there. In terms of avoiding admissions, there is a work stream within the Future Care programme called Alternatives to Admissions, and we're looking at how we can support people being turned around at the front door or from SDEC following investigations. If there is no need to admit, we can turn them around into the community with a different offer of support. So we should start seeing some admissions being reduced as a result of that work as well. So there's a fair amount of work going on to avoid those admissions for people following a fall.
Okay, thank you for that, Jenny. Thank you. Right, if there's no other comments or points wanted to raise, we have got a recommendation on this item. So it's just recommended that the Health and Wellbeing approve the Better Care Fund 2024-25 end of year report. Is everybody content? I'll ask for a show of hands actually, just so that we can feel engaged in the vote on this. Is everybody content to recommend that? That looks unanimous from everybody in the room, so right. Thank you for that. Right, unless there's any other points on the Better Care Fund, we can move on to item 10, our Health and Wellbeing Strategy into Action and Place-Based Partnership update. So yeah, as you'll see from the agenda, so we've got asked for an update on, I know most meetings we've had have been talking about our Health and Wellbeing Strategy into Action plans. So I now I've got Rob and Kat and Mark. We're going to just run through a few slides and update us on where we are. So did you want to start, Rob?
I will do, yeah, thank you. So just a brief verbal update on that since the last Health and Wellbeing Board meeting in March, and I kind of feel like I'm the latest person to join this group of people that are working on developing our new Health and Wellbeing Strategy into Action, but members of the Health and Wellbeing Board will be aware that the current Health and Wellbeing Strategy expired in 2023, and there's been a process of developing our new strategy going forward, and I think also with reference to the Integrated Care Partnership Strategy, and obviously with the Children and Young People's Partnership Plan going forward too, but also thinking about what the role is of a place-based partnership in delivering that strategy, from what also in the context of what we've learned in relation to the national changes to integrated care boards. So I'm going to hand over to Kat to start us off really and tell us a bit about the journey so far, and then Mark's going to give us an update in relation to place-based partnerships as well.
Okay.
Thank you, Rob. And I would like to claim that we planned this exceptionally well with you coming into role in April, just so that you can start the ball rolling off with all the work that we're doing. But I don't think we were that coordinated, but it sounds good anyway, doesn't it? So just to give you a recap, in January 2025, the board agreed the following role, that it would identify topic areas that we can champion, monitor and drive forward as a health and wellbeing boards, and consider it an opportunity to convene system partners to share work programmes progressing in relation to health and wellbeing. We wanted to specifically support the inclusion of health and wellbeing issues in all of our policies, and consider what relevant data and metrics the Health and Wellbeing Board would like to monitor to ensure that we're making progress. We would also want to focus on working together, particularly around co-productions we've heard earlier in the meeting, and to sponsor the work of the place-based partnership and champion integration around neighbourhoods. Next slide, please, Rob. So we have a number of draft principles that were agreed at earlier workshops and at the last board meeting. And we want to very much start with people, not outcomes, conditions or specifics, but listening about people. We want to be able to listen broadly and listen deeply to understand the lived experience, to look at tackling inequalities and the wider determinants of health, to look at targeted place-based approaches and population groups, to use strength-based approaches, and to work with the community and voluntary sector to make sure they're included in everything we do, to think about community empowerment and co-production, and to deliver high quality, joined up and person-centred health and social care. And we also agreed with Sam to adopt the Poverty Truth Commissioned principles, which clearly align with those workshops. And these are to have a consistent and connected services from cradle to grave, a whole person and a whole community approach, to have services that can be delivered when and where people need them and that everyone can access them, to have dependable and supportive relationships, and most importantly, everyone is treated with dignity and humanity. I'm going to hand back over to Rob now to take us on to the next section.
Thanks, Kat. So members will be aware that there was a survey, I think, that took place earlier on this year to identify health and wellbeing priorities for the strategy, and those were identified as children and young people, community mental health transformation, supporting adults to live well and independently, housing, cost of living and poverty. And I've been working with Kat and Mark since I came into post to try to really understand what's behind those words in a way, in terms of what is it that we're really trying to achieve in terms of our health and wellbeing strategy. And I think also the challenge has been set really in the Children and Young People's Partnership Plan to develop a product that is short, that is easy for people to understand, that is co-produced and based on consultation and feedback with others. So there's quite a bit of work that we still want to do in terms of developing our strategy. And I know there was an ambition to have a strategy on a page. Not quite sure we're going to be able to deliver that, but I think everybody agrees that we don't really want a really long document. So we've distilled those initial priorities potentially into 4 proposed strategy priorities, which are loosely named Starting Well, so looking at how we give children and young people the best start in life, mental well-being as opposed to community mental health transformation, but including some of those transformation programs that are already in train. Living and aging well, so looking at how we support adults and older people to live well and independently. And then a 4th priority, which we've loosely described as healthy places and communities at the moment, which would look to try to address some of those wider determinants of health around housing, the cost of living and poverty, but also looking at how we drive forward the integrated neighbourhood teams and health as well at a place and a community level. And we've also had some discussions around some potential drive actions. So I think what I've heard from the previous feedback is that the Health and Wellbeing Board wanted a small number of priorities that it could really focus on and drive forward, rather than a strategy that is full of lots of different priorities. And I think in terms of the emerging strategy, we're thinking that while the Health and Wellbeing Board will be responsible for overseeing all of the actions in the strategy into action plan, we know that some of those actions will be led and delivered through other existing partnerships and delivery boards. And in a way, the Health and Wellbeing Board just really needs to have oversight of the delivery of those strategies. So, for example, the Children and Young People's Partnership Plan, which Kathy presented to us today, we know will be driven through a Children and Young People's Partnership Board. So we may just want to have some oversight around the delivery of that. But there will be other things where we will want to directly drive, and because there won't be another partnership board that is driving some of those actions forward. So the strategy into action will look to identifying a small number of drive actions that will be driven by this board, and potentially coordinated by the place-based partnership, and Mark will say a little bit more about that shortly. And we'd expect the owners of those actions to then potentially give more regular updates to the board, so the Health and Wellbeing Board can monitor progress and shape delivery. So there'll be some actions for oversight, and there'll be some actions for driving the delivery going forward, if members are in agreement with that proposal. In terms of next steps, there's already a piece of work underway to map existing programmes and activities that connect to the locally identified priorities. And I know Health and Wellbeing Board members have been asked to identify people from within their organisations or teams that can support that mapping process. We do want to consult on the priorities and co-production of the drive actions with key stakeholders. And we don't just want to kind of produce the strategy in a vacuum and then bring it here and have it agreed. And we do really want to engage people and bring them with us in terms of the development of that strategy and what the priority drive action should be. Also want to respond to the requests for data and key metrics for each priority area, so we can develop almost a performance framework for the Health and Wellbeing Board, and we can report on performance on a regular basis to the Health and Wellbeing Board in relation to some key metrics. And so the proposal would be to bring a draft strategy and action plan to the next Health and Wellbeing Board meeting in October, but in the context of consultation, and there'll probably still be ongoing consultation at that stage, but hopefully we'll have more to share with you at the board's next meeting. So that's all I wanted to say really in relation to the health and wellbeing strategy. Happy to answer any questions now in relation to the strategy development or to hand over to Mark to give an update in relation to the place-based partnership. Thank you.
Okay, if there's any burning questions for Rob and Kat on that bit, otherwise we'll pass on to Mark then yeah.
Yeah, thanks, Rob. So if you just want to fire ahead onto the, I mean, some of this that's on the slides is probably going to touch back on some of the stuff that David talked about earlier on in terms of the changes that are coming up from a health perspective, but through the lens of potential opportunities, I guess, really, to look at it through that lens and how the place-based partnership could really strengthen itself in the context of some of the stuff Rob has just talked about. So what we've started to do really is to start to look at, as Rob has said, is sort of mapping what's existing going on out there at the moment, but to really think of it through the lens of where is a multi-agency place-based approach required to actually deliver on those particular pieces of work. So obviously they're the original high-level sort of priorities that were sort of agreed through the Health and Wellbeing Board, but obviously be able to drop that down pending agreement today of sort of some of the stuff that Rob's just said in terms of really focusing in on specific areas of that. So basically what we want to do is understand what's needed and what are the gaps to the existing sort of work programs that are going on. We know there's a lot of activity going on across the system, but perhaps what we do also observe is that it's not always joined up in one place, which is where the place-based partnership potentially adds some value. On to the next one. So just thinking about that then in terms of the future horizons, which, I mean, I won't labour on this because some of the stuff's already been talked about around the ICB blueprint and the potential cluster arrangements and a sort of a re-emphasis on strategic commissioning. We do need to be thinking about, well, what does that mean for place and what does that opportunities does that bring to us to get closer to communities and to actually get closer to sort of local agencies and people in starting to meet or starting to listen to understand what they need, but also about how we meet them. And I guess just to sort of re-emphasize the sort of the 10-year plan that's due out in the coming month or two, there will be likely to be an increased prominence of place and neighbourhood. So again, it chimes with everything that we've talked about here today around sort of really understanding what is our sort of structure around how we keep oversight and drive that strategy into action to really improve and embed a positive health and well-being approach to our community. And I guess prevention is going to be a massive part of that, and we've already heard that around sort of the future care and prevention of falls. Rob's talked about some other areas as well, which I think would need to feature within our plan moving forward. So then where does that leave us in terms of the place-based partnership? So again, there's an opportunity for us to sort of think about that leadership model. So as we've talked about, driving that local strategy into action, so really having it focused down on BCP, but also I think importantly thinking about what's that golden thread through to whatever the ICB becomes by the end of the year, sort of in terms of that commissioning at scale, but also bringing that down to a local determination. Similarly, we also need to think about how that ties back through into the integrated care partnership, which again aligns with some of the priorities that we've talked about around thriving communities, about working better together. So all those principles will sort of come out through a place-based partnership. Place-based commissioning, I guess that ties back down to sort of how do you localize that commissioning at scale, and potential opportunities for us to think about how do we do things, again, working better together, accountability based on outcomes, joint decision making, and potentially delegated budgets. So again, this is horizon scanning, thinking about potential opportunities for the future that we would like to sort of pose into the conversation. But more importantly, as Kat said, it's around how do we make sure that we've got closer connection to our communities, with a means of really getting down and addressing some of those inequalities that we already know about, and perhaps there's others that we will learn more about as we can connect better with people. And I guess one of the last points on there is around that social infrastructure. We are aware from work that's been done by something called the Local Trust, which has looked at the indices of multiple deprivation, but then also looked at what's sitting behind that in terms of social infrastructure, and coined the phrase doubly disadvantaged. So what we see is in some of our highly deprived communities, we have a sort of a double disadvantage in the fact that there isn't a lack of social infrastructure, which then prevents us from actually moving forward. So the suggestion is basically that you can put lots of stuff in terms of work programs, but actually if the infrastructure is not there in the first place, that's going to struggle to get sort of any traction. And then finally, the last slide, just around the next steps really for the place-based partnership. Rob's already mentioned sort of the mapping exercise, and we have had the requests go out for sort of nominations to support us with that. I've had a number of those back, and I'm just sort of tidying that up in terms of a template to use to make sure that that doesn't become all-consuming. We do need to think about identifying the gaps once we have that information back. So what are the areas of focus under each of those priorities, which ties back into what Rob has just proposed as well. We've started to draft potential place-based partnership terms of reference, which we'll obviously need to sense check with partners and make sure everyone is agreeable with them. And then sort of, as we've already just talked about, really think about what is it that partnership's going to own in terms of a work program to drive the strategy into action. Thank you very much.
Okay, thanks for that, Mark, and thanks, Kat and Rob, for that information. Any questions or comments or input, Karen? You can come again. You seem to want to comment on everything. So you can,
Hello. I'm going to ask, and there's no such thing as a stupid question, is there? What's social infrastructure, please?
So I guess that is, as I understand it, Karen, is where you're talking about community buildings, community places for people to come together, opportunities for leadership within communities, access to food type places. It's all that type of stuff. But I mean, again, the report sets out some of those details. But I guess what I'm saying is, if there's a lack of community-led initiatives, green spaces, parks, playgrounds, you're really going to struggle to move forward with some of those needs.
I was hoping it was that, because without social infrastructure, things, and this echoes what we were saying earlier on about trying to fix someone and then sending them back into a home or into a community where it's just going to happen again. My mother-in-law lives on the outskirts of Waterloo Estate, and they've just lost their Morrisons. And there's now just a corn shop there, and my husband went in to go down to the shop, and he reported that their Morrisons is gone. There's no longer fruit, vegetables, it's just alcohol, energy drinks, cigarettes, scratch cards. That was it. And he was, and my husband's a builder, he's not into this, but he was like, that can't be good, Karen, can it really? But that is what they have on their doorstep. So that's social. I thought it might be that. We've seen it in other areas of the town as well, haven't we, where we've lost that local place where people can go and visit, and there are some there's some actually really excellent social infrastructure as well. It just really struck me that we need to make sure that that whole determinant is happening. Thank you.
Thanks for that. So yeah, an insightful comment. Anybody else? Richard, did you want to?
Yeah, thanks, Chair. Yeah, first off, the priorities. It's really great to see children and young people on that priority list, and the first one on the priority, and the list were very the same. The only thing that I would say is that the rest of the things on the list also apply to children and young people, except it was like the living well bit on your list. It was just the living well. It wasn't specific to adults, and on your list it was specific to adults, wasn't it? But it was not really a question. It's just, well, yes, it is. How do we ensure that the children bit is a thread through everything? If you see what I mean, because what I don't want, and I did say, I think the children bit at the top is great. It's really good. I'd love to see that. But what I don't want to see is saying we'll put children there and not look at children, young people with the other strands.
Yeah, it's a fair point, and I think probably what the ones that were on my slides were the original things that we talked about at the outset when we did the survey as such, whereas I guess what we're now is drilling down into what does that actually mean, which is what Rob talked about. So we'll take that further forward, and I guess probably what I would sort of say is it's a families approach really, actually. So everybody in this room will have a family which potentially have a child connected to it, so it's really thinking it through that lens as well. So that's where it does tie back to the children, young people's partnership plan as well, doesn't it?
Yeah, because I mean the reason I was saying is because a lot of these things which are on this list, actually, the children and young people are telling us exactly the same thing. The mental health, the cost of living, the housing, it's a thing which you check. And if you get it right for the children and young people, of course, you get it right for the adults, don't you? Yeah.
No, I think that's a good point. Actually, is making sure that when we're thinking about health and wellbeing, we're thinking about health and wellbeing for everybody, and we're not thinking from the sort of the way our organisations are often structured, which is about children's services and about adult services and those sorts of things. Is actually making sure we have those sort of linkages and those threads right through. So, thank you for that point. Any other comments at this critical time to let Rob and Kat know where you're, what input you want or what tweaks or direction? I mean, I must admit, actually, when I saw the sort of drafted slides, they for me it does sort of bring it more to life, actually, knowing those priority areas, but also those sort of drive actions, I think, which is what I think the feedback over the last year or so I've had, that actually, yeah, we want in the future things that we can point to that actually this board has sort of had feedback on and driven through to make sure, whether it's through whichever partnership plan or whichever sort of consortium of partners, that those actions sort of need to be driven through. As well as the metrics, actually, I thought was quite interesting and important to make sure that this board has some measurements that actually that we can look at on a regular basis to make sure that we're happy that the various strategies and plans are being implemented and that are showing an impact for individuals on the ground. Coming back to the sort of conversation we had earlier. So yeah, thank you to Kat and Rob and Mark for putting those together, and we'll look forward to sort of an update at the October meeting on where we're progressing with those. So I don't think there was no decision for us on that. It was just really asking for an update, and we'll carry it forward to the October meeting. So thank you very much for that. Right, agenda item 11. Work plan. So to consider the board's work plan, which has obviously been distributed earlier. So our next meeting is on the 6th of October, and we currently have scheduled the Safeguarding Adults Board annual report, which I know that members will have seen previously at meetings. The BCP Children's Safeguarding annual report. Further on the health and wellbeing strategy into action, place-based partnership work. Better Care Fund again. Scott, you'll be back. You'll get a loyalty reward coming to so many meetings for updates. So yeah, the Better Care Fund, but the 2025-26 Q1 report next time. And I know Rob Hughes message sent you to request that also on the 6th of October meeting we have Public Health Dorset Pharmaceutical Needs Assessment for 2025 to 28. Do you want to briefly update us on that?
Yeah, can I just say a little bit about that? Because it's a statutory requirement for the Health and Wellbeing Board to produce the pharmaceutical needs assessment every 3 years, and the last one was produced in 2022. So we are working towards having one finalised and published in October. We do need to undertake a 60-day statutory consultation. And that consultation is due to start imminently. So it may actually start towards the end of this week. And so what we would like to do is to bring the final report post-consultation to the Health and Wellbeing Board for approval in October. But there will be an opportunity for Health and Wellbeing Board members to comment on the draft during the formal consultation.
Okay. And just in terms of that consultation, would that be publicised for sort of public consultation? Is it mainly partners or public or?
There's a list of statutory consultees. So members of the public have been consulted through a piece of work undertaken by Healthwatch. The statutory consultees for the needs assessment include local pharmacy providers, local NHS organisations, GP practices. There's a list of organisations that we are required to consult with, but not just those consultees. So it will be on the council's website, and there'll be an opportunity to view the draft on the council's website and to submit answers to some specific questions that are set nationally as well. We also are required to consult with health and wellbeing boards in neighbouring authority areas too, because obviously there's quite a bit of cross-border access and travel to community pharmacies. So we'll be consulting with Dorset and with Hampshire and with Wiltshire as well as part of that process, and Somerset.
Right, okay, that's useful, yeah, because I could imagine, particularly areas like Upton, Corfmullen, Wimborne, the areas around our conurbation, there's crossover there. Louise, online, you wanted to come in there.
Thanks, Chair. Yeah, just to say that so the consultation, the engagement that we did with people about pharmacy services is available on our website, and I'll pop a link into the chat so everyone can have access to that.
Okay. Thanks for that. I know we have sort of discussed pharmacies, haven't we, at previous meetings, but I think that's usually around sort of pharmacy sufficiency when there's been changes to, removal of particular pharmacies within the conurbation and making sure there's still sufficient ready access for people in those areas. So, but this is the much, like you say, Rob, the much more overall pharmaceutical needs assessment that we have to do every few years. So, okay, well,
I think the main themes that we picked up were around kind of more rural access. We haven't had as many as in other areas of pharmacies kind of closing, but there's been lots of changes in hours that affects people. Medicine shortages was another thing that was raised by people. So there are some case studies as well in our report, but I'll pop the link into the chat and everyone can have a look at that. Thanks.
Thanks for that, Louise. That's really useful. Any other comments on our future work plan? I'm happy as chair to say that actually pharmaceutical needs, that would be a good one for October, and I think it should be easily within our sort of usual 2-hour timing actually with the other ones that we've got there for the next meeting. Anything else? Any other comments? Kat, sorry, yeah, you wanted to come in.
Thank you, Chair. On the draft forward plan, we have a sort of a hold for an annual report for the Community Safety Partnership.
Yeah.
So Councillor Wilson and I take that to overview and scrutiny in December every year. So potentially that could be a January item if that would be useful for the board. Equally, Councillor Wilson will also be taking 3 domestic abuse strategies to Cabinet in September. So one is our overarching preventing domestic abuse strategy 25 to 30. The other one is the safe accommodation strategy, which sits obviously within housing, but it's a partnership strategy. And also we have a new strategy, which is preventing domestic abuse, looking at how we work with perpetrators of domestic abuse and stalking behaviours. So again, it's an open offer that if the board are interested in any of those subjects, we'd be very pleased to come and bring them back to future dates for awareness.
Okay, thank you for that, Kat. I'll just have to link with Councillor Wilson. Sounds like he's going to be busy at future cabinet meetings presenting those. So yeah, I think some of those may well link in, particularly I guess, obviously at the next meeting we're looking at adults and children safeguarding. Certainly some of those I think are sort of there's important links into safeguarding matters. So yeah, okay, we will have some thought about those and where they could link in. Zena,
Can I ask for the prevention strategy to come at a future meeting, maybe the January one, because it's going to cabinet in October, I think.
Yeah, okay.
Thank you.
Yeah, I know. Had a few discussions about prevention strategy in the last few weeks, and I know we had a big meeting about it a couple of weeks ago. So, okay, yeah, we'll look at scheduling that at probably the January meeting then. Okay. Any other comments or input? If there's not, then I think on the work plan, yeah, it's just really for us to note those that work plan and the amendments and additions that we need to make into them. Future meetings, so just to note the dates of our future meetings, so that's 6th of October at 2 p.m, the 12th of January 2026 at 2 p.m, and the 9th of March 2026 at 2 p.m. as well. So if everybody's happy with that, then I shall call the meeting to a close, and I shall return to my beach hut for the remainder of my holiday this week. Thank you very much. Cheers.